Today we are going to look at the difference between the various ataxia. So before we start a topic, we will all be asking questions. So the first question is, in case of the deep tendon reflex, so in the subacute combined degeneration, how is the deep tendon reflex? Next question is in case of the Babinski sign, in terms of the Friedreich's ataxia, is it positive, is it present, it is not present. So in this video, we'll find the answers to these questions and learn in detail about this topic. So to begin with, we have first, before going with the difference, let us see what is common among them. So what is common? So firstly, let me name the types. The types of ataxia, we are going to deal with the Friedreich. The Friedreich ataxia. Next, the tabes dorsalis and the SACD. So we are going to deal with all these three. So under this, the common points, it includes the vibration sense. So when you look at the vibration sense, it is absent. The symbol means absent. Then what about the proprioception? The proprioception. So here it is again absent. Then what about the P and T? That is nothing but the pain and temperature. This is present in all. So just to recap, the ataxia. So the types we are going to deal with: the Friedreich ataxia, the tabes dorsalis and the SACD. So what is this SACD? It is nothing but the subacute. It is subacute combined degeneration. So this is what it is. And the common points, it includes, there is a vibration sense that is absent, there is a proprioception that is absent, and when we look at the PIT, that is the pain and temperature. So P/T, it is present. Now we'll be looking at some other points, the differentiation features. So first we look at the Friedreich ataxia. Friedreich ataxia. So in terms of the Friedreich ataxia, we are looking at the tract. So how is the tract here? The tract it involves the posterior column. The tract involves a posterior column. It is a pyramidal. It is pyramidal. And next, there is the spinocerebellar tracts. The spinocerebellar tracts. So we saw about the common points. Now the other point is we are looking at the deep tendon reflex, DT reflex. So what happens in the DT reflex? It is absent. It is absent. Then what about the Babinski sign? The Babinski sign is present. So what are the features of this? The features is that there is cardiomyopathy. This cardiomyopathy. Next, there is the optic atrophy, and next there is also the diabetes mellitus. So just to recap, we saw the Friedreich ataxia, and in terms of Friedreich ataxia, the tract involved is nothing but the posterior column or the pyramidal or the spinocerebellar tract. So what about the deep tendon reflex in case of the Friedreich ataxia? The deep tendon reflex is totally absent. What about the Babinski sign? The Babinski sign in terms of the Friedreich ataxia is present. And then what about the features? The features, it includes a cardiomyopathy, there is optic atrophy as well as the DM, that is for the diabetes mellitus. Next we'll move on to the tabes dorsalis. So in terms of the tabes dorsalis, what is the tract involved? The tract involved here is nothing but it is the posterior column. The posterior column is involved in case of the tabes dorsalis. And the deep tendon reflex. What about the deep tendon reflex, DTR? Deep tendon reflex here is nothing but it is absent. It is absent. And then what about the Babinski sign? The Babinski sign is also not present, that is, it is absent. Now, what are the features of this tabes dorsalis? The tabes dorsalis, it has the AR pupil. So what is meant by AR pupil? It is the Argyll-Robertson pupil, and then there is also the bladder disturbance. There is bladder disturbance which is present. Now just to recap, we saw the tabes dorsalis, and this tabes dorsalis, it involves the tract, the posterior column. So what about the DTR, deep tendon reflex? It is totally absent here, and the Babinski sign is also absent here. The features is AR pupil is nothing but the Argyll-Robertson, that is the Argyll-Robertson pupil. So the Argyll-Robertson pupil is present, as well as there is some bladder disturbance. Next, we'll be looking at the SACD. What is the SACD? So the SACD is nothing but there is a subacute. It is nothing but a subacute combined degeneration. So this is nothing but the SACD. So under this, we are looking at the tract which is involved. So tract which is involved is there is the posterior column, then there is a pyramidal. So this is similar to that of the Friedreich ataxia, so pyramidal, but here there is a change. There is also the peripheral nerves. Now, what about the deep tendon reflex? The deep tendon reflex, the DTR. So here the DTR, it is present. Another thing is later it can be lost. Then when we look at the Babinski sign, the Babinski sign is present, whereas in case of tabes dorsalis it was absent. Now what about the clinical features? The clinical features here, there is a vitamin B12. There's a vitamin B12 deficiency. So just to recap, we saw the SACD, which stands for the subacute combined degeneration. And what is the tract involved? There is a posterior column, there is a pyramidal, as well as the peripheral nerves. Then we look at the DTR, that is the deep tendon reflex, is present. And whereas in later stages it can be absent as well. The Babinski sign is present. So in the SACD, there is a deep tendon which is present and the Babinski sign present. So what about the clinical features? Clinical features, the vitamin B12 deficiency is seen. Now we'll be answering our question. So the first question we asked was in case of the SACD. SACD, we know by now it is nothing but the subacute combined degeneration. So in this case, what is the deep tendon reflex? So what we need to know is that we just discussed that it is present, but with time it can degenerate, that it may be lost. Then we look at the second question is the Friedreich ataxia. So what about the Friedreich ataxia? The Friedreich ataxia, it is, we asked about the Babinski sign. Babinski sign is present in terms of the Friedreich ataxia. So the only case where it was absent was in case of the tabes dorsalis. The other disease, it was absent. So just to recap, we saw the subacute combined degeneration. So the DTR, that is nothing but the deep tendon reflex, is present, but over time it can decrease, that is it may be absent. Then we asked in case of Friedreich ataxia, what is the Babinski sign? Babinski sign is present, but in which case is it absent? It was absent in case of the tabes dorsalis. So this was about the discussing the various types of ataxia. To learn and grow daily, please do subscribe.